lose their value. They're not as meaningful as a therapeutic modality or component unless that image can be expressed and converted into language. As we said in the beginning, language is the essential means by which we are able to communicate both with ourselves and with others. And without that language, there are frequently misunderstandings and misdirections. It reminds me of an experience I had some years ago, which turned out to be accidental. I was teaching hypnosis at a medical school, Seton Hall Medical School in New Jersey, to a group of residents in various specialties. And as part of the course, we would give demonstrations with patients from the various services and from the wards, so that on one occasion we would take somebody who was suffering from extreme pain or post-operative pain and demonstrate the use of analgesia, anesthesia, pain control, and management. We take patients from the psychiatric service with anxiety states or with depersonalization states and indicate how hypnosis could be appropriately used. And then one day, the director asked if we could demonstrate how you would prepare a woman for childbirth, very much as Professor Markuson has described his own experiences, and as many of you have used hypnosis as a means of preparing for childbirth. And a number of us had done studies in which hypnosis was used as the primary means of pain control during childbirth. So there was a young woman on the service in the hospital who was due to have a child, her obstetrician said, in about 2 weeks. And she said she would be perfectly willing to demonstrate and for us to prepare her for this. And the course was given in a large lecture amphitheater. So she was wheeled in on her bed with 2 nurses in attendance, and I went through the induction of hypnosis as a preliminary to describing how one would go about preparing a woman for childbirth. And within about 5 minutes into the induction, she surprised all of us by having her baby right there and then. And as strange as it may be, there was no obstetrician within handy range. So the 2 nurses who had simply wheeled her in delivered the baby. This was childbirth under hypnosis, unplanned. Afterwards, in talking with the woman, she said she had never felt so relaxed in her life. And while her obstetrician may have miscalculated the dates somewhat, I suspect, nobody anticipated that she was going to give birth to a baby within minutes of coming into that lecture hall. I cite this only to indicate that the anticipation and the expectation of patients plays a large role in how they respond to the hypnosis and the meaning that it has. I think it's very important that all of us understand, even though we've done it for many years, that hypnosis to the patient has a different meaning than it may have to us as therapists. And what that meaning is sometimes not very conscious. It is therefore very helpful to try to evaluate and assess how the patient is responding to hypnosis in terms of what it means to them. To some patients, hypnosis becomes equated with a threat of death, a loss of consciousness, a loss of control. With others, it has obviously magical implications, and their expectation becomes intensified so that there is nothing that they cannot imagine can take place as a consequence. But again, once the demand situation has changed, then the nature of the meaning of the hypnosis has changed. And as Gill and Brenman some years ago, in their work at Menninger, made clear, hypnosis does interact with ego states, and that ego fluctuates during hypnosis. It is not always at a constant level. It is not always at a regressed level. It is sometimes regressed and sometimes not, and means that somebody who works with hypnotherapy has to be in some ways more observant and more vigilant about the subtleties that are taking place in the hypnotic interactions, and take those into account in terms of planning other sessions with patients. And I think there is no therapist, regardless of the kind of therapy they use or carry on, that can always anticipate what the patient's going to do in the next session. You must be prepared for the spontaneity of that session and what it will bring up. But with hypnosis, there's an added component. because you never quite know what state, what level, what interaction or what dynamic quality will be present in the hypnotic interaction, in that hypnotic relationship at that given time. It will vary. For example, we carried on a research investigation at a large municipal hospital in the emergency room. Physicians who were being trained in hypnosis, once they had acquired a level of skill, would be in the emergency room, and when a patient was brought in, they would then, unless the patient strongly objected, and this never happened, without telling the patient what was being done, but as a means of helping that patient immediately upon admission to the emergency room, they would quickly induce hypnosis and then go about doing whatever was necessary medically or surgically. To give you one illustration, a woman was brought in on an ambulance one day. This was part of our training program. She'd been in an automobile accident, and her right eye had come out of the socket and was dangling down beneath. She was in acute pain. She was hypnotized immediately upon admission to the emergency room. She then said she felt no pain. She was very frightened because she could see the eye dangling, and it was explained to her by the surgeon attending that there were two options. They could remove the eye, or they could put it back in the socket surgically, but that she would not have any vision from that eye. And she indicated she wanted them to put it back in. She was so responsive to the hypnosis that when they wheeled her up into the operating room, they did the entire surgical procedure under hypnoanesthesia. No drugs were used. About 6 weeks later, she was seen for a follow-up examination prior to being discharged. She had healed perfectly well. Everything was fine. She had no vision in the eye, of course, but she was very comfortable. At that time, as part of a routine reassessment, she was tested for hypnotizability. She was a very poor hypnotic subject. There was no possibility of producing even glove anesthesia in her, although somebody tried for 15 to 20 minutes. In other words, again, we see that the demand of the situation produces the responsiveness to the hypnosis, so that sometimes we have to create increased motivation. We have to use the therapeutic context to create a motivational basis if a patient is going to respond to hypnosis and can see hypnosis as a means of anticipating their own recovery. If there is no anticipatory concept that this device, this modality, this approach is going to be related and can be related to expectations of recovery and of well-being, then it may well be that one is minimizing the hypnosis, and one is minimizing its therapeutic efficacy. For example, I presume in Italy, I'm not sure, but in the United States, hypnosis is used fairly extensively in burn centers. Patients who have experienced extensive industrial burns following industrial accidents, usually where 25–30% of the body surface has been seriously burned. Hypnosis is used because, as you know, when a patient comes into a burn service, they are in great pain, and sometimes the mere removal of their clothing is agonizing, and they cannot tolerate it. They scream in pain. And before any kind of anesthetics can be used, there are other procedures in terms of dealing with the damaged skin tissue and removing all of the clothes and helping them that has to be undertaken. With hypnosis, most of that pain can be controlled almost immediately. And in one interesting case reported in Park Hospital in Dallas, Texas, a woman was brought in which 40% of her body surface was burned. She was dealt with on a hypnotic level initially without any pain, but then, as you know, severely burned patients have metabolic problems which occur. And one of the characteristics is they will not eat. And without eating, and with the dehydration that takes place, they frequently die of the complications. This woman had responded very well to hypnosis. However, when food was brought into her room to eat after she had been treated medically, she pushed the tray away and she would not eat it. At which point the psychologist who had treated her with the hypnosis was asked to come back And he rehypnotized her and told her that she would eat all the food on her tray. The tray was brought back in, and it was very interesting what occurred at that point. She ate all the food on the tray as instructed under hypnosis, and then promptly regurgitated all that food back onto the tray, and then reconsumed all the regurgitated food so that she complied with the request, and she finished everything on the tray, although originally she had regurgitated it and simply took it back in. Many of these characteristics of hypnosis, where we get dramatic, emphatic, and direct alterations in transcending what I would call voluntary levels of behavior. In other words, voluntarily, it's very hard to ask somebody to eat a meal, to vomit it onto a tray, and then to eat the vomitus back up. That's a very difficult thing to do. I suspect none of us know anybody who could voluntarily do that. It would be repulsive, difficult, it would make one sick to do it. Under hypnosis, these associations and these elements, these normal voluntary reactions, are suspended, so that all she was doing was complying with a direction and a request, without the critical judgment, without the critical discretionary judgment. And this is the key point that I'm trying to make, that happens in the suspension of certain ego functions, is that under hypnosis, where there is sufficient motivation, where there is sufficient demand situation, part of which must be created by the therapist, because the condition itself frequently mitigates against that kind of motivation. You've got contrary forces operating. That when that motivation is sufficiently there, a very important element of discretionary judgment, of reality appraisal, of reality testing, is now suspended and is in the transference in hypnosis realigned with the therapist, where now there is a delegation of ego function, so that in effect we have a shared ego operation taking place. And that's why, to the naive observer, it appears that magical things are happening. There's nothing magical happening at all. You cannot produce magic with hypnosis. You can only produce things that are possible. But that which is possible on a voluntary level is very different than that which occurs on a non-voluntary or involuntary level. And one of the advantages is that you can manipulate, and I use the word not with any negative components, because I think manipulation in the interests of patients, particularly patients in great distress, in great pain, in great discomfort, or with severe incapacitating illnesses, that manipulation is in the service of their best interests, and therefore other ideas or concepts about intervening with manipulative approaches don't necessarily enter into considerations ethically or otherwise, and that it's perfectly all right to use such methods. But it is only by that suspension, and it is in, and I go back to what we were doing this morning, it is in the condition of alexithymia where it is possible to intervene and to bring about a much greater cooperation and compliance with all of the modalities of the human brain and the mind, and that it is the use of that central nervous system and that cortical capability that is necessary to transcend voluntary capacities. You see, by and large, even though we talk in more sophisticated terms about neurotic illnesses, about emotional disorders, emotional disturbances, we're still in a basic sense talking about the normal voluntary capacities of human beings to deal with attention mechanisms, concentration, pain, thinking, judgment, response to feelings. What we need to do is frequently to transcend those voluntary levels and deal with involuntary levels. Many reactions that we observe in children are not so voluntary. Until they develop to 5 or 6 years of age, a lot of their responses are more involuntary. They're more reflex-like, they're more spontaneous, they're freer. There is a correlation, there is a parallel, again, as Ph.D. has pointed out, in that in hypnosis we suspend some of that logical, rational, critical judgment and permit the individual now to operate really very much through delegated relationships, through delegated instructions, through delegated ideas. To give a simple clinical illustration, some years ago I saw a man who had to have surgical repair of a damaged Achilles tendon. It had been damaged congenitally at birth, and it was extremely painful, and he could not walk normally. He was now about 35 years. No, he's old. He's about 45 years of age. It was a time when they first began to use surgical procedures to repair congenitally damaged Achilles tendons. And those of you not familiar with the procedure, it involves taking the Achilles tendon and producing a graft, and the grafting process requires that the leg be attached to the hip to use the tissue there as the graft, and the whole body put in a body cast. And that cast has to remain, and the patient has to remain in that position for about 25 days. Now, this was a man who had a history of being claustrophobic. He was very anxious about the procedure. He was willing to undergo it, but he said to his surgeon, "There's no way I can stay in a cast with my ankle attached to my thigh in a plaster cast for some 20-odd days." He said, "I will go crazy." He said, "I will scream and yell. I will be impossible. You will not be able to do this." I saw this man, and this is in connection with kind of reviewing some of the ideas that Professor Marcuson asked this morning, some of the current trends of the applications of hypnosis in a variety of ways, different than the specific focus that I have been attending to during the greater part of this workshop. This man was seen for a different approach. This was not psychotherapy. What we did was use techniques that Cooper and Erickson have described in a volume. Some of you who may not be familiar with it would find, I think, as therapists, very worthwhile. It's called Time Distortion in Hypnosis, the manipulation of time variables on hypnotic levels. What we did was really very simple, but only simple to do. In other words, when I say it is simple for the therapist to do it. It is very complicated for the human being to experience it. But fortunately, we don't have to get that complicated. We can do things more simplistically because the patient's capable of doing the complicated part, and that is the response mechanism. In several hours of training, we were able to distort his concept, his sense of time, so that eventually he was able to perceive 24 hours as if it were 24 seconds. Now, this is not done in one repetition. Again, we used some of Cameron's psychic driving techniques. We repeated gently, not too aggressively, but repeated over and over again on a tape, because it's hard for a person, a therapist, to do this just by voice alone. It will change his inflection. The tape simply said, among other things, that you will now experience time in a very interesting and different manner. And first, minutes were transformed, and then hours, until we reached the real goal, and that is a 24-hour day will feel like 24 seconds. And it will be just like 24 seconds. It will feel like 24 seconds. Nothing will change your perception of that. Even clocks will move so rapidly that you will only see 24 seconds change on any clock that you see. And this was repeated over a period of many hours. He went into the hospital. The surgery was very successful. He stayed in the cast. He was a model patient. And I spoke to him on the phone, and he said, "I can't believe how pleasant an experience this is. All I'm doing is eating." And he was eating constantly because he liked to eat. He said, "This is a vacation for me." And he says, "I'm getting out very soon." He said, "I didn't realize they made the time much shorter." He says, "I'm only going to be here for, I don't know, less than a day." He was there for 26 days. They took the cast off, and he had little difficulty in movement, some little bit at first, he moved around. And then when I saw him in the office, only at that time, and we'd spoken on the phone during the better part of this month, every day, and in talking I reinforced the ideas, but very subtly. never making any reference to what we were doing, just that you're going to continue to feel the way you're feeling, and you're going to continue to respond the way you're responding. That was as far. And then we just talked about how he liked the hospital, how good he was getting nursing care and things, kind of just general chat. He came into the office after he had recovered from surgery, was discharged from the hospital. For the first time, he made reference to the procedure. The very first time, virtually a month. He said, you know, that was amazing. He said, I really experienced time differently. He remembered everything I said. But during the period that it was operating, he didn't want to talk about that. He didn't want to have any critical judgment about that method. He didn't want to get into it at all. I didn't initiate it, but I was clear he was not about to talk about it. Afterwards, he said, that was fascinating. He was a writer. He was a professional journalist. He said, someday I'm going to write a book about this. He said, it was the most amazing experience of my life. He said, time was different. He said, it was shocking. I would look at the clock on the wall, and he says, it was whirling around so fast. He said, I couldn't believe it. And I once asked the nurse if there was something wrong with the clock. And she said, no, nothing wrong with the clock. It's perfectly all right. The distortion of time is one of the elements in discretionary judgment that can easily be altered. It has many uses. It is useful in helping people comply with medical regimes, with medication schedules, with accepting time as a factor. It can be used to make time short or long, so that if people have a feeling of wanting to have more time to do things. It's like, for example, it is very helpful in some therapeutic situations where some patients feel very pressured by time. They feel, I don't have time to talk about all these things in an hour. I just don't have time, let alone 45 or 50 minutes. During the induction of hypnosis, it is a very simple element to indicate that you're going to experience time in a very different way. You're going to have a sense of having all the time you need now, all the time that you need to say and to deal with everything that you want to right now. And in an interesting way, you're still going to have all the time remaining for everything else you want to do today. In other words, we're not stealing time from any place. We're not acquiring time from some other responsibility. All we're doing is stretching time, and you still have all the time remaining. These are devices that Cooper and Erickson worked on for a number of years, and as I say, it's a most provocative and worthwhile volume. And it is a technique which has applications in many areas, so that, for example, in helping patients heal from various kinds of surgery, in the study I referred to earlier this morning at the Veterans Administration Hospital in Brooklyn, patients are also told that each day the body was going to heal as if that day were equivalent to a week. And the alteration in that time with a control group has had dramatic differences denoted that healing takes place more rapidly. There's also a book written by a British physician some years ago, Jacob Cohen, called Time and Disease. It's an old and not too well recognized book, but if one can get a hold of a copy, it's about 20 years old now. It is a rather brilliant exposition of the way in which time influences and alters body rhythms and body mechanisms. And as such, the alteration of time can be very helpful in dealing with a variety of different kinds of problems that are encountered normally in psychotherapy. Cooper did some other interesting work, which I'll just make a passing reference to, which had nothing to do with psychotherapy. In testing his work, he used a group of professional musicians. And professional musicians are very accurate about one thing. They know how long it takes to acquire perfection in playing a piece, like a violinist, knowing that he has to play a certain section of Brahms, will know exactly how long he's going to have to practice before he's going to go on stage and play that piece the way he needs to play it. What Cooper did was, he took a group of volunteer professional musicians from the Symphony Orchestra in Washington, D.C., and he developed new pieces that they had not played before, but which in reviewing the piece they said, yes, this will take me 12 hours to acquire skill in. He then distorted time, and in one case, in distorted time that was equivalent to 15 minutes world time,